So remember one of the examples that I gave at the beginning of the day today was this idea that if the pelvis was tending to go behind the legs a little bit, there'd be the sense that the quads were being pulled up. So that is what I'm going to talk about in the next couple of minutes here. And you might even have a sense, like if I feel like, oh, here's your quads, here's me sort of moving them up, and you go, oh yeah, we can do that. We do that all the time. And then if I pull them down, they kind of go, oh, not so much. Again, if I'm thinking about the middle of the quads, and I'm thinking about, is there a bias? Is there sort of an up and down bias? And if I feel here and I go, here's how this tissue moves up, here's how this tissue moves down, it likes to go up better. Here's how this tissue goes up, here's how this tissue goes down, it likes to go up better. So that's me thinking about the middle. And then if I think about the ends, I could go up here near the top of the quads, and you'll feel like when I draw the tissue away from the attachments, there's that kind of fairly hard feeling, you know, like it doesn't, I can't move you very far before it feels like it stops. Mm-hmm. And likewise here, even harder, because this side's a little more unbalanced. Because this side of your pelvis goes behind your leg a little more. And so there's a harder feeling when I pull down here that doesn't like to go down. And down here at the other end of your quads, now I'm not thinking so much about your pattern right now. I'm just thinking about how good is the mobility at the end of the quads near the knee. And it feels a little freer on this side than it does on that side. You see what I mean? So there's this thing, there's this term that we use a lot called end feeling, meaning that when you move the tissue as far as it's used to easily going and you hit that barrier, and the question is, how hard is the barrier? And essentially, we're judging how strong is a restriction and even how important is a restriction by how hard is the end feel. So when I go like this, and like that's a fairly hard end feel. And so I want to do something about that. When you're trying to get your hands on a soft tissue structure, we're going to really emphasize the idea of sort of wrapping your hands around it and having a really three-dimensional kind of contact with it, which means trying to sort of gather it up in your hands, but not change the shape of it. So as opposed to kinds of technique where you would say, well, the first thing I'm going to do with the quad is I'm going to flatten it against the leg, or I'm going to squeeze it like this or something. I'm going to leave it in the shape that it's in, but I'm going to hook it and glide it. If I were to start in the middle of this quad, so you'll feel like when I get to there, now I've kind of taken the slack out of it. I'm at this barrier, and you know, you can see I have a really big contact with it. You know, I have a lot of the quads in my hand. Right, even you can see if you sit up. So now it's that same feeling as what we talked about earlier today, where I get to the barrier, and then I pull the tissue through the barrier, I glide the tissue through the barrier. And you can